think we're going to go ahead and start. So it doesn't look like we have our chair. So my name is Brenda Costello. I'm actually staff liaison, Washoe County School District Family Resource Center for the Intervention Department, and I will go ahead and call roll. So Chair Scott Benton, Perla Garcia, Miss Ann Corey,
I'm here.
Rachel Kingham,
I'm here as well.
thank you, Rebecca Paris, and Mr. Jose Gomez.
Present.
Okay.
Brenda, do you have quorum?
We do have quorum.
Great, thank you.
So item 2.0 on the agenda is items for presentation, discussion, information, and action, public comment. Do I need to read the whole thing, or can I just ask if there's public comment? Is there any public comment? Seeing none, we'll go to item 2.01, approval of the minutes of the March 20th meeting, which was held at Desert Skies Middle School.
I would move for approval. This is Anne.
Perla Garcia, I second.
There's a motion and a second to go ahead and approve the meeting minutes from March 20th. All in favor?
Aye.
Aye.
Wait, Brenda, you need to check for public comment before
Oh,
an action item is taken.
Sorry. Thanks, Sarah. Any public comment? Seeing none. Now I call for the vote. All in favor?
Aye.
Aye.
Any opposed?
Aye.
The motion carries to approve the minutes. Okay, item 2.02, presentation and discussion of the Washoe County School District funding status, including the status of grant applications, possible action to provide recommendations to staff on scheduling future fundraising and publicity activities. Possible action item. Miss Lisa, would you like to take this one?
Good evening, everyone. Lisa Guzman for the record, and I'm happy to share with you that we have very recently received some notices on two of our grants that we submitted. That's the Title IV-B grant and the Children's Trust Fund grant. There is an attachment. If you are online and have logged into have gone to the Diligent website, all of the handouts would be on there. I apologize for not emailing all of them prior to the meeting. Some of them were last minute. So for our Title IV-B funding, which is actually split into two grants, a family preservation grant and a family support grant. And between the two of those, we had requested $230. Our award came in just under $50,000 less than what we had requested. However, it was an increase of $15,576 from last year's award. So the total is, under family preservation, we received $75,036. This funds our work with children who have been removed by the child welfare system and then reunited with their families, and the Family Resource Center provides support services to help them remain stable. And in our family support program, which serves basically everybody else, we received $105,096 for a total of $180,132. Then for our Children's Trust Fund funding, we had requested $140,000 and received $120,000, which was 85% of our request. So although it would have been nice to receive closer to what we had requested, we certainly knew that we would not receive everything and are happy with this funding and very appreciative to the state for these awards. Can I answer any questions on our funding?
This is Jose Gomez. Question, what is the Children's Trust Fund funding for?
I will let Brenda respond to that, as that, I'm giving it away, funds our parenting programs.
So this is Brenda Costello for the record. Children's Trust Fund is child abuse prevention money. So with that money, it provides most of my salary and 2 of my staff's salary, and we conduct the parenting programs for the school district. So, and in combination with that funding, along with the Title IV-B funding, we get most of our referrals from Child Protective Services. So we get referrals to go out and do kind of low-level service level through Title IV-B, and then that often piggybacks with, can you also do parenting with them? So this is our child abuse prevention money, but it also funds 3 staff positions. We had put in for a 4th staff position. We were going to split it between those 2 grants. Because we didn't get the full amount, that position will not be filled.
Thank you.
This is Ann. May I just offer my congratulations?
Thank you, Anne.
Thank you, Anne. It's a nail biter. The last one, the Children's Trust Fund, we got notice of that today. These are for jobs that start July 1st. So
Nothing like the last minute.
nothing like the last minute. Okay, moving on to item 2.04, presentation and discussion of the Washoe County School District Family Resource Data and Outreach Events. Oh, did I skip one? Sorry. Presentation and discussion of an event in recognition of Family Resource Day in May of 2024 and includes a new promotional video. I will have one of our other FRC specialists come up for like the next 2.
This is Jasenia Segura for the record. As Brenda introduced, we do have a brand new promotional video for all of our FRCs, which are 5 locations. I work together in conjunction with our communications department for Washoe County School District, and with their support and all of our support as well, and staff included, we wanted to emphasize all of our 5 locations where we're housed and our staff, and what it will look like when families come and visit each of our centers. So you will see it. It's a little over 2 minutes of a video. So we're trying to pull it up right now, and hopefully you will be able to see it and let us know any feedback. We're very proud of it. It took us a while to get it all together, and it was posted all over our social media. We do have a Facebook page, an Instagram page for Family Resource Centers, and it does get the support of our Washoe County School District Communication Department as well. So as we try to pull that video up, our FRC Day is May 15. So with the efforts of all the discussions we've had in previous meetings on any ideas on how to celebrate and emphasize this important date, we came up with this great short video, and hopefully it's able to play soon. Okay, that was our video, and let me know if you have any questions. But I know it's rather fast, but that's the length that is approved for social media. So if you have any questions, please, I'm happy to respond.
I want to commend the great work that you guys doing. This is a great video. Actually, Jose Gomez. Question: have you guys asked your community partners to share this video? Because I think you guys do amazing work, and sometimes it's important to have your community partners to share all the great work so they can reach to more people.
I completely agree. It is posted on our social media. We have shared with all of our partners and our clients and our families and community where to find us. But yes, if we will continue to reach out to our community partners and reinforce the fact that they can share as well as needed. Thank you for that.
No, of course. And do you guys have like a possibility maybe having testimonials on the video to show the impact that you guys have on these communities on your videos?
We haven't done that yet, only because there is a social media release approval and for each of the clients that may come apart. This was just a first kind of try out and see what it will look like, because, since we just recently found out we have an FRC day, but that's a great idea for future ones. It's just the process of approvals with our Washoe County School District Communications Department. But anyone that forms a part of we have a couple of more videos that our communications departments have done for us, and we're able to show those faces of some clients that approve to be a part of it. But what we do find a little bit challenging is our clients may not feel comfortable, because most of them come in crisis and they don't want to, Reno is a small city and everybody knows everybody. So in order to keep that confidentiality high and respect it on their request, it will be a little bit challenging, but it could we could try to see in the future how will that look like. But thanks for the input.
This is Brenda for the record. So apparently when I started the video, the YouTube overrode what our online people could see. So we will be sharing that video through email so that you can make sure and see us and our advocates in all of our loveliness. So.
Perla Garcia.
This is Rachel. I did get to see it earlier, and really great job. I just thought it was awesome. So fantastic. Congrats, you guys. I know that's a lot of work.
Thank you.
Perla Garcia. I just thought it was wonderful to show a little tour of like the inside. It's very, it feels like a very safe and comfortable atmosphere, which I think is really important for like the communities that you're supporting. So thank you for sharing.
Thank you.
So this is Brenda again. So we actually have two members here in person who were actually at an outreach event that we had, which coincidentally fell on FRC Day. So thank you to our two reps that were there wearing all of their various hats. But thanks for coming out, and Perla for recognizing staff. That was amazing.
Of course. Thank you for all that you do.
Okay. Thomas, how do I get that? Data now.
What do you need? Oh, just
I don't want to override anything.
just want
The flash drive again. I just don't want to touch anything. All of a sudden they'll be broadcasting to Mars. Okay. So, Jesse, this is you too. So we're going to do a presentation and discussion, item 2.04 on data and outreach events, including future community outreach events and volunteer opportunities.
Thank you. This is Yesenia Segura for the record. And as Brendan mentioned, we're going to start with the Family Resource Center's data presentation for the last quarter of this school year, which includes months of March through June. So the first slide talks about the call log of the database we use for phone calls and text messages throughout all of our 5 locations, including the JPO transition that we have, and also the call flow, which is the main number we all share when clients call us and don't really necessarily understand which extension to dial, and they press the 0 option. It dials all centers at once, and so that's the reflection of them calling just to get a hold of us. As you can see, the data from March 1st, 2024 through June 14, 2024, we had a whole combined total of 3,376 calls. Text conversations we've had from the same date range, March 1st through June 14th. With all centers, we had a combination of 3,816 text messages. For the next section, we are continuing sharing the Google business data we have for our centers. You can see the difference in June with Central FRC. You can see the demographics of people reaching out and the needs that they're reaching out for. Social Services Resource Center and Washoe County Resource Center, where they search on Google, as well as the North Valleys. And I've included a couple of Google reviews that people are, once they visit us, are able to post. And then next, it has the next centers, such as Sparks FRC and Sun Valley FRC, along with each of their Google review. Last but not least, we have our recent family success story, and this one is from Sparks Family Resource Center, which is overseen by Lisa, my colleague right here. So the story pretty much shares that they have been working with a single teen mother for nearly 2 years. She was referred to the FRC via the partnership we have with Awaken, which was initiated due to Title IV B2 funding. She had experienced sexual exploitation, was pregnant, and facing many challenges. The FRC has been an ongoing source of support for this client, and we are honored to have her trust. The Sparks FRC has assisted her in many ways over the years, but particularly around public assistance benefits. This due to the PTSD. She struggles with navigating the complexities of applying for benefits and providing information in a timely manner. The FRC specialist became an authorized representative on her DWSS case, which is the welfare office, to facilitate the application process for her. With frequent changes in her income and living situation, and even with this additional support, there have been lapses with her benefits, and the Sparks FRC will have helped her to reapply once again. We, as FRCs, have partnered with our SNAP outreach worker from the Food Bank of Northern Nevada, who also assisted her during the on-site SNAP outreach at the FRC. Working diligently together, we at Sparks FRC has helped her submit the necessary documents, and she's now receiving SNAP and Medicaid for herself and her son. The FRC has connected her with her Medicaid MCO, which is the health plan that client has chosen, for additional support and to ensure that they are receiving the needed medical and mental health services. Any questions? Okay, now we're gonna move on to our next section of events and collaboration on outreach efforts, and we have Lisa here who will start.
Lisa Guzman, and I'm going to talk about our outreach events and collaborations since we met last time in March. We have been busy, as you can see. We continue to have SNAP outreach at all of our sites. We also continue to serve as intake sites for the SAFE and energy assistance programs. Some of our staff attended the Student Attendance Review Board meetings. We had Catholic Charities food distribution at Sparks High School. We have hosted the mobile harvest through the food bank, where they give fresh fruits and vegetables at our Sun Valley and North Valley's locations. Feemster, Sun Valley, and North Valleys host a biweekly food pantry. We attended the Hug High School Wraparound Services meeting, Family Stability and Community Schools meeting. At Sparks and North Valleys, we host small group ESL classes in conjunction with Northern Nevada Literacy Council. We had a Division of Welfare Community Partners meeting. We had a partnership meeting with One Care Kids, which provides amazing services to children with special health care needs. We met with the new Washoe County School District Victim Advocate. We attended a partner meeting with several domestic violence agencies. We attended the Northern Nevada Continuum of Care Homeless Prevention Leadership Council. We had in-service trainings that were very informative with Molina and Silver Summit. We attended the UNR Social Work Field Fair to recruit social work interns for the fall. We attended a Silver Summit Community Baby Shower, Washoe County School District Early Childhood Science Night. We presented to the school social workers. We had a tour of Awaken to also see their school there, which is very interesting. We attended the Washoe County Prevention Conference. We had workshops with Ken Dellin, which provides kith and kin parenting classes. We had free laundry days in conjunction with Mr. Bubbles and Molina. We attended the Asian Community Development Council Resource Fair. North Valleys had an event that provided shoes to middle schoolers in conjunction with Project 150 and Molina. We attended school district recruitment fairs at North Valleys High and Sparks High. We had our virtual FRC day where we debuted our new video, which you just saw. We attended a meeting with Altrusa. We had the North Valleys Park Community Fair through their Parks and Rec. We attended Good Shepherd's Clothes Closet Resume and Job Search event, Family Health Festival committee meetings, as well as the Family Health Festival event, a Nevada Women's Fund event, Project 150 event, TMCC and Safe Embrace Take Back the Night event, a diaper giveaway hosted by Intertribal Council and Molina. And Molina has also graciously offered us to attend a community health worker class in Spanish that many of our staff have signed up for. Upcoming events, if you would like to attend any of these, there's another school district recruitment fair if you want to help us spread the word about that. This Saturday at Alice Maxwell. We'll be attending an event of the Reno Police Department Victim Services Unit on June 26th. And that is at Miguel Rivera Park? Robin Hood Park. Thank you, yeah. Robin Hood Park. Sorry, I left that off there. Sheriff's Office Christmas in July on July 27th. Catholic Charities is hosting an asylum workshop on July 25th. There's a Family Health Festival coming up at Hug on August 3rd. And if you have any spare time and would like to log into the National Family Support webinar, they host Webinar Wednesdays. And if Scott was here, I know he would ask what were my favorite events. And they were all lovely, but I would say I really enjoyed the in-service trainings with Molina and Silver Summit. That was very informative, as well as the Awaken Tour. Can I answer any questions?
This is Ann. I just have a comment. When in combining the client success story that you told and just the intensity of that client interaction, and then the number of events and variety of events that you participate in, I don't know how you guys do it, but it's amazing.
Thank you, Anne. That's greatly appreciated. And we don't know how we do it either, but we do it. So, and we'll keep doing it.
One
Thank
foot in
you.
front of the other.
Yes, exactly.
Thank you, Lisa and Jesse. So item 2.05, this is an ongoing item that Chair Benton has requested that we chat about. So we've been breaking it up into manageable bits. The presentation and discussion of the Washoe County School District Family Resource Center strategic plan for presentation and discussion. And I think I'm actually first. So Brenda Costello for the record. And we're going to talk about the strengths of the Family Resource Center. And so let me find my place in the strategic plan. Thanks. So this strategic plan, Miss Ann Corey, was conducted by a good friend of ours, Sheila Leslie, helped us out with this back in the day, which seemed like it was 10 minutes ago, and it's already time to start thinking about the next one. So last time, our last meeting, we discussed like the first part of it. So we're going to jump into situational analysis, which is basically that the Nevada FRC network has supported local communities by providing essential core services of information referral and case management for the last 25 years. I believe that quote is directly from the NRS statutes. In 2007 through 2009, during the recession, there were a lot of programs that took a really hard hit. Some of them were eliminated. Centers closed, centers run on a skeleton crew. There was tumbleweeds going down the middle of the street. It was a bleak time. And the report determined that the Nevada Family Resource Network had not kept up with the national FRC movement, which has adopted new evidence-based family strengthening models over the last decade. And we're not ready to serve the exponentially greater need of Nevada families during the COVID pandemic without renewed investment. The report identified strengths, challenges, and opportunities as outlined below, and as part of the strategic planning process, FRC staff and advisory board members review these components of the statewide situational analysis, and they agreed that they do accurately reflect Washoe County experience. So the strengths of the FRCs is the culture of what we do, the deep understanding of the distinct needs of the communities, flexibility, innovation, and resourcefulness in utilizing disparate funding streams, materials, and resources to provide effective programming, the local collaborations that address specific neighborhood needs, and the adaptability to change in local culture, such as increased use of social media as a communication tool, and I would add text messaging on top of that. So an empowering organizational culture as documented by the CCAT results. The attributes of the staff, so the passion and the commitment to helping families, children, and seniors, the empathetic and deeply understanding of difficult family circumstances. We're skilled at working with people in crisis, and we are excellent managers of our available resources. We're key champions and a voice for the communities, and we have a strong leader vision and internal leadership as documented by the CCAT results. This up there. So we're a trusted community resource. We have a welcoming atmosphere for people seeking assistance. We're relevant conduit for community-based services, the front line of every community crisis, expertise in core service of information and referral, expertise in case management, especially when combined with empathetic approach to encourage people to access services, strong community partnerships and relationships with public and private resources. So somebody else gets to take the challenges.
And this is Justenia Segura for the record. Speaking of challenges, the unstable funding we were just talking about at the beginning of the meeting, it's a big crucial part. Financial challenges at macro and micro levels have resulted in the elimination of some FRCs and diminished services at others. The lack of funding impedes program development and full realization of role that FRCs could play in helping Nevada families. FRCs are sometimes overwhelmed with the sheer number of families seeking help. FRCs attempt to address the lack of stable funding for core services in various ways, which can take them away from providing direct services. FRC staff must focus on addressing crisis and ongoing needs of their community and have not developed marketing and fundraising skills as documented by the CCAT results. The perceived value is the difficulty in measuring the true value of the FRCs beyond counting the number of people served or the cases plans completed. The prevention of the family problems or concerns is especially difficult to quantify at a neighborhood or a community level. The accountability is the increased level of the grant compliance and reporting requirements from the state presents challenges. The high turnover in state FRC staff has reduced the communication and collaboration. The CCAT results documented challenges in leadership sustainability, difficult in cultivating future leaders, and a need for more detailed plans for leaders succession. And I'm going to now leave it to my next colleague to continue the next part.
Good evening, Jean McElwee for the record. I get the opportunities side. Leadership and support from the state and community. Critical leadership opportunities exist at a local and state levels to champion family resource centers and re-envision their impact. Investing in Nevada's FRC network is appropriate at all levels of government to increase district conduits of services to the vulnerable populations. Specific investment opportunities exist. Engaging elected officials and civic leaders in sharing the vital role of FRC's play in community services delivery may generate more attention from the public and private funding sources, which also publicizing the availability of services to their constituencies. FRC Advisory Board members can help attract resources, support staff, and develop skills in fundraising. Individual community champions of FRCs can advocate for FRCs as service delivery mechanisms as families recover from health crisis, unemployment, mental health, anxiety, and general economic insecurity during the pandemic and its aftermath. I've noticed just recently just more PR to seeing us in the news with all the different events that our FRCs have had in the last 2 years has helped a lot of on the PR side. Fund diversification and development, seek new funding sources along regional or programmatic lines, possibly involving multiple FRCs. Carefully evaluate state and local funding streams to align with the mission and programs of FRCs. Access to new federal funding streams, such as Families First Prevention Services Act, to deliver prevention services through the FRC network. Increase outreach and marketing of FRCs to sell the FRC story, which I think can also be a challenge because of the short staff that we have. Elevate the profile of the FRCs in policy discussions and strategic planning for community-based service delivery. Consistently address local needs at community level, obtain information regarding the needs of communities and neighborhoods, include FRCs in planning and implementation of new or expanded services, strategically advocate for devolving service delivery from government to FRC community-based locations, support development of the field, utilize FRCs as natural incubators for innovative solutions, support demand for professional development activities, promote peer-to-peer learning and knowledge sharing to leverage innovations and support replications. Last, evidence-based practices, elevate collective best practices to national standards. consider participation in the Strengthening Families Network, national network, and support implementation of this research-informed approach to increase family strengths, enhance child development, and reduce the likelihood of child abuse and neglect. Which leads to the core capacity assessment results.
Lisa Guzman, and I'm going to wrap up this part of our discussion with talking about the core capacity assessment tool, or the CCAT, that you have heard my colleagues mention and might have wondered what that is. So CCAT stands for Core Capacity Assessment Tool. And when the Strengths and Sustainability Project started, that was spearheaded by Sheila Leslie, we had the opportunity to participate in this survey, which I learned is a rather expensive tool that some organizations are able to use to evaluate their capacity and kind of use as a basis for strategic planning. So it was very nice that we had the opportunity to participate in that, especially at no charge to us. So when we're talking about the CCAT, which our advisory council at the time participated in, as well as our grants department and some other key stakeholders. So like I said, the CCAT kind of identifies the life cycle of the organization. So Brenda, sorry, I'm going to ask you to skip around a little bit on the strategic plan if you don't mind, so we can just kind of talk about what these stages are first, and then we'll hop back. So that's on page 33.
Getting dizzy. Okay,
There we go. Okay. So this talks about the lifestyle stages of a program, and it emphasizes one is not better than another or worse than another, that all programs kind of continuously move through these stages, and it's important that they do so that they don't become stagnant. So the 3 stages that are identified: core program development, closely aligning an organization's programs with its mission and vision, clarifying how these elements relate to each other. FRCs in this stage need to clearly articulate mission and vision and align these to program development. Established organizations want to ensure a strong connection between programs and their mission and vision. Then we have infrastructure development, which is a focus on the systems needed for an organization to operate smoothly, such as policies, communication, evaluation. FRCs in this stage need to build additional capacity to implement programming and strengthen organizational processes prior to expanding impact beyond their core program delivery. And lastly, we have impact expansion, which means that the organization is broadening its approach to achieving the mission impact beyond its core programs. This may include strategic alliances, partnerships, policy and advocacy work, or further outreach in the community. FRCs in this stage need to determine how best to achieve impact beyond core program delivery. This may involve strategic alliances, policy and advocacy partnerships, and or further outreach in the community. So that illustrates what the different lifestyle stages are. Now, sorry, Brenda, if we can please go back to page 11. So notice at this time, you also heard some of my coworkers talk about funding cuts and shifting of centers. So right prior to the implementation of this project, we had taken a big funding hit, and we actually went from 5 centers to 3 centers. So you'll notice on here that there are 3 centers that are identified here, and those are Central and South Reno, Desert Skies, and Sparks. So unfortunately, we had to close our North Valley site as well as our Northeast site at Bernice Matthews Elementary School. So these were trying times for us. So this CCAT survey that we all took, that was really long. There were like hundreds of questions. I mean, it was very long. Anyway, the results of that indicated that our Central Reno site, some ways to build capacity there were to help our leaders develop a clearer vision for the organization and to manage program staff with a focus on staff development and securing funding and staffing and the ability to retain staff. So it's kind of interesting that we came out in that part because at that time Wiley had recently shifted to the director of the Central Reno Center, so it kind of makes sense that that center would come out at that level. And then Desert Skies and Sparks were in the impact expansion lifestyle stage, and it was recommended that Desert Skies focus on resource sustainability, diversified funding streams, and to increase financial stability, technical skills, developing and expanding skills in outreach, marketing, and fundraising. And then for Sparks, it was recommended that we could also work on resource sustainability, completing our strategic plan and meeting those deadlines, diversifying our funding streams, and of course, increasing financial stability, as well as leadership sustainability and trying to prevent the organization from relying too heavily on one or a few members. So I know that was very lengthy. That's a little bit more about our strategic planning process and how that all came to be. Like Brenda said, this will be an ongoing item on our agenda, so you'll hear more about it, but can we answer any questions for now?
This is Brenda for the record. I just want to commend our people that were here at that time because it was during COVID. We weren't allowed to be in the same room. We had to do all of this 20 feet apart or on Zoom. It was exhausting. It was a lot. So good job.
Perla Garcia for the record. Since this was during COVID time, right? How were you and staff able to utilize like the information that was given? And have you seen like that progress in the centers?
So much of the results from this process did lead us towards our strategic plan, which this is kind of the build up to that. Maybe next time or the next couple of times we'll get to what's actually in the strategic plan. Just before, like Brenda alluded to, it'll be time to redo it because that was a 2020 to 2025 plan. So yes, and then as well, there was a statewide document that was created that illustrated the strengths of all of the FRCs, so we'll be able to share that with you at some point as well. So this was a very useful process for us internally as well as the FRCs statewide.
Thank you.
This is Ann Corey. How do you feel about your progress in following the strategic plan? I mean, you're back up to 5 centers. You've managed to add some programs and facilities. You're reaching larger numbers of people than ever before. Do you feel pretty positive about the progress you've made?
Lisa Guzman. So I do feel like we have made a lot of progress in many areas of the strategic plan. We have increased our social media visibility. We're doing increased outreach. I think that we are more visible in the community. Funding is still a struggle. I think we're doing well and we're maintaining. Would it be nice to continue to diversify and try to bring in different funding sources? Absolutely, and that's something that we're always looking at. So I think that that was a useful tool, and we have accomplished many of the things. I can't say that we have accomplished all of them. We, of course, do still have more work to do. It's a balance between serving the clients and running our centers and trying to meet the goals and activities of the strategic plan. But I think that's always going to be a work in process, and at least we have that as a guide to be working towards.
And this is Brenda, and I would echo all of that and say that we are trying harder to do some cross-training so that it doesn't fall all on one person, which is never a good model to do. But we have a really good team now that seems to work well together, and we can lean on each other, and we often do. And also to echo what Lisa said, funding. Sometimes it feels like the tail wagging the dog. So when a funding opportunity comes up, we will jump on it and then build that airplane while we're flying it. So
I appreciate your comments, and I think you've accomplished a lot of what is in that plan. And the next one will look, in some ways, different because you'll be moving on, which is great.
thank you, ladies. Well done. So do our FRC specialists have anything else to add to tonight's meeting? Okay, so we're going to do 2.06, then we're going to go to our closing items. So 2.06 is review of the upcoming Council of Family Resource Centers meeting dates. This is what we've got on the calendar now, is the September 18th, January 15th, March 12th, and June 18th. And a reminder of the importance of regular attendance, and then a reminder that there are 2 vacancies. So if you got any friends, so we would always love to have them on the council. So we do only meet 4 times a year, but it provides invaluable insights for us. So closing items, do I need to do anything, Thomas? Okay, public
Question?
comment?
May I ask a question?
Yes, of course.
This is Ann Corey. Have you had any luck reaching out through the Human Services Network in recruiting new members?
As of yet, we've not heard anything back. I do have my sights set on someone. I'm courting them now. So
Good. Well, court away.
I am. Oh. Thomas, they just. Oh, she's back. Okay. Hurry,
Yeah.
Lisa, public comment.
Lisa Guzman, just to clarify, Ann, so Human Services Network did publicize our vacancies, but to my knowledge, we have not yet gotten any applicants from that.
Okay,
But we'll keep
great.
trying.
Thank you.
Okay, so.
I have a question about the
yeah.
vacancies. What are the requirements for the vacancy? Is there a particular person you guys are looking for this position? Because I know there's different names for each position, correct?
I don't think there's, I think that, I don't think any position would preclude anybody from applying. So it's more of a name, like if it's, we have a chair, but, and it's not like, it's not geographically determined. And I think we are always looking for an elected official, but we don't have to have one on our board as long as that elected official will review our plan with us. So other than that, no.
Lisa Guzman, just to add to that, I think that ideally we would want a candidate who is knowledgeable of and committed to issues impacting children and families in Washoe County. And I think that's kind of the main criteria.
Thank you.
This is Ann Corey. Have you considered asking the Children's Cabinet to nominate someone?
I don't think we have, and I think that could be a really good fit.
It could be, I think, too.
This is Jose Gomez. Have you guys publicized this on your social media or not? Is that something you guys can do?
Sorry, this is Jasenia Segura for the record. I started shouting and then realized I'm not in a public park. So there are limitations on what we can post since we are representatives of the Washoe County School District. So in regards to those type of matters, we will have to get legal department guidance along with the communications department guidance in our school district of what we can and cannot publicize on our social media.
Thank you.
This is Ann Corey. One other thought is perhaps reaching out to the Women and Children's Center of the Sierra. If they have a staff member or a participant who might be interested. It's easy to think up ideas if I don't have to follow through with them.
Good suggestions. Thank you, Anne.
And this is Jose. On top of that, maybe Boys and Girls Club?
Going once. Okay, item on the agenda is item 3.01, public comment. Do we have any public comment? We have one.
Lisa Guzman, I would like to officially recognize Jasenia Segura for her creative and artistic abilities in creating our FRC video. She's the hand behind the camera there, so thank you, Jessie. I know that was no small feat, especially since you had to do it twice. So thank you for that. And I would also like to acknowledge that this is Rachel Kingham's last meeting with us as an FRC council member. And thank you, Rachel, for all of your time with us and all of your support. We really appreciate it, and you will be missed and are wished well.
I did want to just commend the entire team of the skeleton team. You are incredible. And I also want you to know I have all kinds of feelers out to try and find someone who would be able to step onto the board, and also some hopeful financial support. So it doesn't fit for me right now as far as time goes, but I think this are incredible. As a social worker, I can't tell you how important it is that we get to the prevention side of things and we do the work beforehand, so the children and the families. So just the biggest kudos of everything to your staff and volunteers. Just amazing. So thank you.
Thank you, Rachel. We really appreciate that.
Thank you, Rachel, for your commitment to us. Any other public comment? Seeing none, the 3.02 is the announcement of the next meeting, which is September 18th, 2024. And item 3.03 is to officially adjourn the meeting. Do we need a motion? Okay. Meeting is adjourned.
Thank you.